the first suspicion happens definitely at the clinical stage, or then at the radiology stage.
Right.
But the guidelines say histopathology is the gold standard, because in that case you are going into the cell and looking at the cell and saying that, okay, this looks like a cancer. This does not look like a benign or non-cancerous lesion. Okay, that closes the extent of diagnosis. The confidence in the diagnosis.
Right.
There would definitely be certain very obvious lesions which one can be sure of, even sometimes clinically, and even sometimes radiologically. But to give that, see, it's a life-changing diagnosis. We have to understand cancer is a life-changing diagnosis. So life-changing in the sense that there is so much emotional, this journey one has to go through. It becomes a long fight for the patient. So it has to be 100%. It cannot be like, a suspicion. It has to, it's either there or not. Even if, it also comes with experience. A very, very experienced clinician may just touch the lesion or touch the patient or, touch the lump and say, okay, this looks like cancer.
Okay.
It will always look like cancer. It cannot be, the treatment cannot be started. These are such heavy treatments. They cannot be started without a confirmed diagnosis. So even if we are sure radiologically, even if we are sure on a FNAC, not even FNAC, a biopsy is definitely needed to confirm the diagnosis. Even also to subtype the lesion, subtype the malignancy now, because the treatments are so specific for different kinds of cancer, different subtypes of cancer, that it's also important to subtype the malignancy using immunohistochemistry or some other techniques. Just H&E routine histopathology is also not enough. So it comes with the changing or evolving technologies, evolving science. Okay, there was a time when just a clinical diagnosis was good enough, right? But because of the evolving technologies, we need to be almost 100% sure of our of the things we are doing. So that's how the whole spectrum, the whole group of diagnosticians comes together, and it's very important.